Seattle is making changes to address emergency response times and keeping paramedics on calls considered true emergencies. KARA 7's Rob Munoz reports on the expansion of Health One.
When firefighters leave the fire station in Pioneer Square, it's often for a call just a few blocks away. All too often, those calls use up resources that could be free to respond to major emergencies.
We know that every day the Seattle Fire Department has become almost the healthcare provider for the people experiencing homelessness.
Today, Seattle Mayor Jenny Durkan and Fire Chief Harold Scoggins announced the creation of Health One. Made up of 2 firefighters and a social worker, its intention is to work with some 60,000 calls for issues like drug overdoses or smaller medical emergencies downtown and in Capitol Hill.
It's going to serve those people who don't really need to go to an emergency room. A person could be having a mental health crisis, and our firefighters and our social worker will be able to meet them.
Seattle Fire Department says last year 42% of their calls were for those lower level emergencies. Current protocol can only take patients to the emergency room when all they really need is a social worker or drug treatment. Mayor Durkan says she's hopeful this $400,000 plan helps with downtown issues.
We need a spectrum of services available in our city core. We need our police to be able to respond to true police emergencies, our firefighters to be able to respond to true fire emergencies.
The Health One crew will be on call from 9 a.m. to 7 p.m. daily, focusing on when services for those issues are open. Eventually, there'll be a direct line for Health One, but right now, people can call 911 to get a dispatcher to get them that help. It's hoped that this will be a working model and eventually it'll spread out across the city. In Seattle, I'm Rob Munoz, KARA 7 News.